Hi, I'm Jim Collis. I've been a technician for a long time. I own Collis Prosthodontic Laboratory. We're in the northwest suburbs of Chicago, and we're primarily a removal laboratory. We do a lot of implants, we do a lot of dentures, and a lot of partials. And there are some products that I'd like to talk to you about that are going to make your life a lot easier. I've been using GC products for quite a long time, and I got involved with their acrylics a long time ago. And one of the things I really like about their acrylics is they're always trying to evolve. They're always continuing to advance. They have 7 shades that we have to choose from, which is really great. Although there are a few shades that we use as a standard. But I give my doctors the option to pick from 7 different shades, and we do a lot of custom work, so that really helps out a lot. On top of that, we always use their new ultra high impact acrylic. It's the highest impact acrylic on the market. And a lot of people a lot of doctors ask for the hardest acrylic. Well, we really don't want the hardest acrylic. What we're looking for is an impact resistant acrylic, which basically means that it's a little flexible. And I hate the word we use flexible, let's say bendable. It will absorb impact instead of shatter or break. So we use GC's ultra high impact acrylic. It does a fantastic job, and it comes in the same 7 shades that all their other acrylics come in, and the shades are very consistent. We also have the pour acrylic, which doubles as the repair acrylic. We use high ET20. 7 shades gives us a lot of versatility. And on top of those 7 shades, we go ahead and naturalize the denture base using Gradia. We use Gradia gum, they're gum colored, they're composites, and we have a composite primer that we can use manufactured by GC. So these composites allow us to make that denture come to life instead of instead of a denture tooth sitting on top of a denture base. We use good teeth. The teeth I've been using lately are Shofu teeth. It's a new tooth to the American market. They're taller. They look like natural teeth coming out of gums when you put them on a denture base material like GC's high impact material. We then go ahead and naturalize the denture base with composites, and we have light colored composites for the tissue blanching. They have the dark reds, light reds, there's browns, there's blues, there's violets. So there's many things that we can do to make these dentures pop out and come alive. These new products allow us to come up with a fantastic result. And one of the things that makes me angry is when I see all these reality shows that are not really reality shows. They all have the makeovers, meaning they get the haircut, they get the nails done, manicures and pedicures, they get their makeup done, and then they get laminates, and they get bridges, or they get implants. You know what? A lot of people can't afford implants, and a lot of people can't have implants. So what's next? The next thing is a viable solution, which is a full denture, maybe a partial denture. There are other alternatives to implants if the patient can't afford it or can't have it. Now we have an alternative or something else we can do other than the standard old denture. And on top of that denture, we can apply composites to make them look absolutely beautiful and natural. We can take old dentures, we can reline them, we can revitalize them with composites, and therefore they're laminated, which they're very strong. So there's so many things that we can do with the new products like the composites, Gradia, with the ultra high impact materials. You know, patients can rest assured that their denture isn't going to fall out of their mouth and break. So we have a lot of alternatives now, and I'm really excited about this. I've been doing this for a long time. Let's keep up the good work and take a look at companies like GC for their products. And sometimes it's like having another person in the laboratory with you to help. Customer service is fantastic. So anyway, I hope you give them a shot like I have, and keep everybody smiling. Good luck. Thanks.